Hi, I'm Steve Hassan, and I am absolutely delighted to be with an old colleague and friend, Laurence Sugarman, pediatrician and professor at RIT, Rochester Institute of Technology. I want to get the correct thing for you. You're a
Hmm.
pediatrician at Easter Seals Diagnostic and Treatment Center, but you're also the research professor and director of the Center for Applied Psychophysiology and Self-Regulation at Rochester Institute of Technology. And Laurence, I begged you to do this a few months ago. You said I'm too busy. And I checked in again with you. And we met in, I believe, 2012 in Bremen, Germany at the International Society of Hypnosis conference. And we became like enamored of each other's, fans of each other's work, and
Yes.
just as human beings. I want to plug the first textbook that you did, which is Therapeutic Hypnosis with Children and Adolescents. This is especially important, I think, for all pediatricians to learn, all doctors, all mental health professionals. But now you have a new book that I think is a much broader,
Yes.
updated edition that I wanted to help get the word out on. It's called Changing Minds with Clinical Hypnosis. And it's fabulous. And as you know, one of my passions working with cults is the unethical use of hypnosis. And I don't do clinical hypnosis with my clients. I take my knowledge and I help them understand how it was abused. But you are full time healer, healthcare practitioner with an interest and expertise in autism spectrum disorder as well, I believe, from talking with you previously. So I just want you to share what you're working on and what you would
Yeah.
like to tell the public
Yeah.
about this
Yeah.
volume.
Well, uh, so first, I appreciate the work you do and why our work is mutually uh, beneficial and complementary. I think uh, I don't I one of my favorite statements to annoy my students is that all dichotomies are false dichotomies. We create a dichotomy for its usefulness of seeing poles, but we live in the gray. And so it'd be too easy to say you work on the dark side and I work on the light side. We both work in the gray zone.
Yeah, and
And
I'm going to take a
yeah,
moment to plug my influence continuum model and say it's a
there
continuum
you go.
of the light and the dark. So there's lots of things in the middle, but then there are the bite model
Yeah,
criteria and the evaluation of the credentials of the
yes,
practitioner and whether or
yeah.
not they're ethical or not.
And one of these days, while we're still capable, we're going to find an opportunity to teach together because I think it would be really rich. But having been a musician playing in lots of traditional music bands, it's also about playing music together.
Yes.
So, with that said, it's interesting because I started out as uh, in going to a medical school, the University of Missouri, which then was this, ivory tower tertiary care center in Columbia, Missouri,
Hmm.
which was then a small town, is now a big thriving city. But
Right.
and so primary care didn't exist. It was all experts,
Hmm.
right? And um, and then I went to and I chose pediatrics in part because of the opportunity to be out front, to be the to deal with risk and potential, risk and
Hmm.
resources, which is really where I got to at the end of our new book. Um, and uh, and when I came to the University of Rochester and I've been living in Rochester ever since, in upstate New York. Um, I became aware of the value of primary care, of good primary care, and I went from believing that I needed to be an expert in some narrow, reductionistic, cellular level understanding to thinking much more broadly. And the University of Rochester is where George Engel worked. George Engel had an appointment in the Department of Psychiatry, but he was an internist.
Mm-hmm.
He was an internist who was fascinated by analysis and fascinated by conditioning and mental health, and conceived in the early 70s, wrote about the biopsychosocial model. And he was immediately rejected because people said he was throwing out all of our knowledge we've gained in the previous 100 years of medicine, of understanding things down to a molecular level. And he was really saying, no, cells and genes are still really important. The inputs into how they are expressed include relationships, include community, include culture, include experiences.
Yep.
And it adds an infinite complexity. And I really started grappling with that when I said, I'm going to take out a loan and start a solo primary care practice, and was and confronted with a tsunami of behavioral issues.
Yeah.
Families dissolving and reforming, developmental differences, sleep, depression, anxiety, chronic pain, anxiety, habit disorders, anxiety, coping with chronic disease. And I realized that primary health care was primary mental health care. And then I started finding out about people like Karen Olness and George Engel, and Bill Moyers in the early 90s came out with this amazing documentary on healing in the mind. And I realized that some of that was going on in Rochester. And I met Bob Ader, who is the patriarch of the field of psychoneuroimmunology, not just how our feelings affect our immune system, but how our immune system shape our minds. And I learned about that there was a systematic study of how to communicate with people in order to help them change, and that was hypnosis. And that, of course, as children, we are constantly in the process of learning how our mind works. Right. I reject the term mind-body. It's kind of like saying apples and apple cores.
I see. I like that. I'm guilty of saying mind.
Well, we are conditioned to, but the fact is, our life experiences are grounded in our potential to express certain genes.
Yes.
And our genetic expression forms a filter through which we see the world and experience things. And the notion of categorical approaches that break things down rather than the awesome systemic holistic approach. Right. I was talking with a friend, a wonderful clinician who has a strong background in Buddhist philosophy and Buddhist practice. And we were talking about you, and we were talking about cults. And he said, you know what the largest cult is? What? The cult of self. The cult that says we actually have independent individual selves and aren't actually blended. I love that problem. I'm struggling with it since. So I, of course, was, as so many people have been, and I've had the privilege of helping other people learn, clinicians do. I was just blown away by the efficacy of helping children learn to use their imaginative capacity to help themselves in physiological ways. And that became a calling. Mm-hmm. Mm-hmm. And I produced a video documentary, and then started saying we need more textbooks. That first book is a multi-authored book. It was, Bill Wester and I edited the first 2 editions of that together, and together we contributed to about half the chapters, but the other half of the chapters are colleagues. Uh-huh. So it's almost like a recipe book. And that led to seeing more and more young people on what we now call the autism spectrum, because they have really interesting issues about self-regulation and self.
Hmm.
And I learned a lot, which we can talk about eventually if we want, about how they validate the importance of learning self-regulation. But over the last decade or so, my interest in this has broadened beyond pediatrics to how do we help, how do we change healthcare?
Yeah, the
Because,
broader systemic
right,
need,
exactly.
and the pandemic is just bringing to bear,
We,
um,
it, it,
right?
it, it, you know, our book was in proofs in March and April, and I hadn't been looking at it, and I started saying, "Oh my God, is this now irrelevant?" And then we were sent all these proofs, and I'm reading it and going, "Oh my God, this is
You nailed it.
even more
Yeah, no,
prescient."
you nailed it.
Uh,
And the storytelling makes it
yes.
digestible.
Well, can we talk about that for a moment? The story.
Please.
So so this all has to do with because they may bark in the background. Abe and Lily are two dogs. Because when I'm here's Abe. When I'm stuck, having sat at this desk for too long, they know to come in and insist on a walk. Oh, good, he wasn't paying attention.
You're
I
not
could have,
taking the
I
walk.
could
We're
have,
finishing this talk,
I
buddy.
could have spelled it, but he knows how to spell it now.
Okay.
um, and then of course I'm flooded with ideas because I'm away from the desk and exercising and using my body as it was supposed to be used.
Right.
And uh, this all happened in a 30-minute jaunt. uh, I was preparing. I'd given the gift of a of 3 days to do of 3 days to do a solo workshop in France, and I had months to prepare, and I was been thinking about it and about pulling all of this disparate stuff I'd been doing together, and it dawned on me that day one could be understanding mind and how mind changes. Uh, Understanding the mind as a systemic information flow throughout the system, limited to some extent by our corporeal body,
Right.
but and then next to understand mind with that understanding through a developmental frame, as if our life is a series of unfolding algorithms that increase mind's potential, and then finally set that into social relationships.
Mm-hmm. Mm-hmm.
And I was thinking about that, and then my guilty negative part of my upbringing said, you haven't redone, you haven't done the third edition of your text, of the pediatric text. And it dawned on me that I really didn't want to, but this was more relevant. And oh my God, those could be 3 parts of a book.
Right.
And as I got home, and then I thought about Julie Linden as the co-author, because she's a wonderful psychologist with whom I can write and work well, and has expertise in trauma and relationships that I didn't at that time.
Mm-hmm.
But as I got into the yard, I started thinking about how all of these books have clinical stories. We do these clinical stories. And
Yep.
unless you're actually watching, either they're live in the room or watching an unedited video, all those stories are stories.
Yep.
There are versions. We, the clinician, are telling them. That's why there are not many clinicians talking about their errors and mistakes
Right.
and their own traumas. But since they're stories anyway, it dawned on me that we really could create a holistic representation by including fiction in a textbook.
Yep.
Who does that? And creating real literature that really shows, sometimes art shows so much better than science.
Sure.
And it, as I walked into the house with this idea. My wife was eating my fortune cookie from the night before. And I said, with great maturity, that's my fortune cookie. And she said, you could have the fortune. And the fortune said, call an old friend. I have it right on my desk here.
Mm.
Lee Warner Brooks was my best friend starting in ninth grade. He was about to retire as professor of poetry and composition at the University of Michigan.
Mm-hmm.
He and I share a birthday.
Okay.
We're the same age.
Mm-hmm.
And so Julie, Lee, and I met on Monday mornings for 2 hours for a year and a half and concocted this mixture. So between each chapter of the book is an episode of 4 different short stories of 4 individuals who never meet. And then finally, Lee had the brilliant idea at the end that at the end, all of the characters would turn to the reader and break the fourth wall and say, this is what we need you to know from our lives. It really works. You can feel from the chapter to the story to the chapter, your brain shifting left and right. And they complement each other, and not neatly. You can't read the chapter and say, oh, this story's about that.
Well, you also have
way.
questions for discussion that I like
Yes.
as well.
Well, I'm teaching the course
Right.
that I've been teaching for all these years from the textbook this year. Yes.
That's
Yes.
great. All right, I'm gonna put you on the spot because we're
Go.
30 minutes in. What are the key concepts you want to convey that will get people to buy this book and take the time and read it and digest it?
Well, as you know, I'm a terrible self-promoter, so I don't know about buy the book, but this book is about the truth that our minds are embodied, that to understand mind as containing your immune system and your skeletal system and your thoughts and your experiences and your kidneys, and that these organ systems don't know they're distinct. They don't know they have divisions in the Department of Medicine.
Right.
Those were things made up.
Right.
So first, that we live in embodied minds. And second, that they are constantly changing and evolving. And we add intention to that. We add interpersonal relationships to that. Then we absolutely drive improved health. And that finally, health is not the absence of disease. You could imagine a Venn diagram. One is healthy, strong attachment to others, social function. A second aspect of the Venn diagram is what I should call a trophic environment. I don't want to use a negative and say non-toxic. A trophic environment. I remember, in medical school, somebody, professor said, "So what's a normal lead level?" And I went, "Isn't it like under 10?" And he said, "No, a normal lead level is no lead." Right? A therapeutic environment, a trophic environment, and third, what Charles Darwin always said, our ability to adapt, our ability, especially since we're not always in a trophic environment and not always in a good relationship. How do we develop a sense of resilience, of intentional resilience? Oh, I've never done this before. Oh my God, this feels threatening. I got it. I can handle this. I can preserve myself and be safe in that. So, and therefore, we shift, and this is the revolutionary part at the end of the book, we shift paradigms from a reductionist diagnose and treat, allopathic, you use this medicine or this procedure for this problem, to
Yep.
something that's absolutely person-centered. And that on rounds in the teaching hospital of the future, the attending physician is the student, the resident is anxious about presenting to the attending physician, because the attending physician is going to say, what are this person's strengths and what are their resources for healing? Everybody knows the diagnosis and all the laboratory tests. Even the patient has those. They're on their computer feed.
Right.
The question is, what are their risks and what are their resources? And how do you build those resources, including their resources for changing their minds? Finally, about this, one of the benefactors at our Center for Applied Psychophysiology and Self-Regulation at RIT was a emeritus professor who became a health activist, and he gave us a significant amount of seed money. And I played music for him as he died. He was in a hospice that he literally helped to build, surrounded by cards, letters, and people who knew him from around the world, hooked up to no medication, as he chose how he would exit his life. And at one point, holding his hand, we were talking about that. This environment, these relationships, and your self-regulation. This dying man, my last conversation with him was, Joe, you're the healthiest person I've ever met. Now, in my training in the model, he couldn't be healthy. He was dying. We lost. I got news. We all die.
Right.
The question is how we live and how we build that ability. And I'm staying in present tense. He's the epitome of health.
Yes. Yep.
So that's what the book is about.
So, I think the public has this notion of hypnosis from stage entertainers.
Yeah.
And what you're talking about, and what I've learned as well, is about clinical, ethical, healthcare uses of the power of words and the power of the mind. And I'd like you to just flesh that out a little bit more to correct the errors that people are walking around.
Yeah. So not surprisingly, my understanding of this is informed by your work. So here's the point to me. I think that influence communications, so-called, and the words are fine, but Morabian showed many years ago that our nonverbal and our prosody, the music of our language, are about 93% of the communication. And the words, the lyrics, as compared to the music and the dance, are less potent. And they're very important. That our communication will always be controversial. Trilby by Du Maurier was the first book to outsell the Bible in the 1880s, 1890s, about that evil Semitic Svengali. In the movie versions, his hands are always like this, by the way. The evil Svengali influencing for his own profit this innocent young woman. And it was the first big portrayal of hypnosis. Even before that, though, hypnosis was seen as very controversial. James Braid, who allegedly coined the word, had amazing. He was the scientific community and the church in England both didn't like his work.
Right.
I think there's a fundamental reason for that. The fundamental reason is that human beings, more than probably any other animal, prize, value our autonomy, our ability to think for ourselves and be creative, I think it's really valuable because, frankly, it doesn't exist. That we are all influenced by each other,
Mm-hmm.
and that the ability to intentionally use our interpersonal skills to influence another person, well, 99% of that on the planet is at least to get you to buy something you don't need.
Right.
If not, to subjugate you, objectify you, and diminish your value.
Mm-hmm. Mm-hmm.
But within a clinical setting, practiced with, in accordance to World Health uh, canons of ethics, to be transparent, to tell the truth, thereby respecting our need for autonomy, to do our best only to do this to promote somebody's well-being, to be equally accessible to everybody,
Mm-hmm.
and to fully inform people of risk. Doing that is a very special way of using this powerful influence.
Mm-hmm. Mm-hmm.
I believe hypnosis is at the core of all healing,
Mm-hmm.
our relationships, but it's certainly at the core of all self-destruction and all negative influence and all negative. So we have, if it weren't for the undue influence of hypnosis, I wouldn't have a job to do.
Mm-hmm. So, would it be inaccurate to say that, and this is simplified, that we have a conscious mind of where we are paying attention, and we have an unconscious mind that's constantly taking in information and processing it and everything else, and that this conscious mind is kind of a dictator in the sense that it thinks it knows everything, right? And
Yeah,
it has certain beliefs that it's using to filter reality. And
yeah,
that therapeutic hypnotic communication is really trying to bypass that dictator with a limited set of beliefs, trying to access resources and emotional states and such that are unconscious in
yeah.
order to help heal or to help, ground a person.
So beautifully said. I'll I'll add a cartoon to it. I
Cool.
heard I heard uh, I heard that new research shows that of all the information energy exchange within the central nervous system, information and energy are the same thing within the central nervous system. How a different one molecule binds a receptor to change information in the cell and what it will do next. Of all of the information energy exchange within the central nervous system, 1% goes to support consciousness. 99% goes to support what you and I would call non-conscious, where the spotlight isn't beaming. To which my response is, I'm going for 2%.
Right.
that our goal is to make that the separation between consciousness and non-conscious is a made-up veil.
Mm-hmm. Mm-hmm.
And there are religious practitioners in cultures around the planet who can melt snow for 2 feet around them
Right.
by projecting energy. There's all sorts of potential so that hypnosis is even grander than that.
Mm-hmm.
It isn't and hypnosis, when used therapeutically, has significant side effects. People feel better about themselves. They feel empowered. I'm doing some research with colleagues on using hypnosis for pain, and they have, and we make no suggestions about anything other than comfort.
Mm-hmm.
And what do the majority of the people participants find? These are all people with chronic disease and chronic pain.
Yeah.
Oh, they sleep better.
Yep. Yep.
So as one of my colleagues says about hypnosis, he says, well, it's like the dentist. The dentists say you only need to brush and floss the teeth you want to keep. You only need to do hypnosis if you want to feel better and work toward your potential. But that's within a therapeutic, compassionate, respectful, transparent relationship. You remove the transparency, you remove the respect, you remove the person-centeredness.
Yep. And, people can learn self-hypnotic techniques too, especially if they're in a state of anxiety. You mentioned anxiety
Yes,
multiple times, and I
yes.
think with the economy and the pandemic and our current president, everybody's anxious. Talk
So
about that.
yes. Well, in my clinical work, I often start with a fake intellectual exercise. Meaning is not really just intellectual. I'm going for a change.
Okay.
And I ask my patients, the people who come to me for care, uh, quite quizzically with a beginner's mind, what's the opposite of that? Right? So the opposite of anxiety is not being calm. Anxiety is looking towards the future with dread,
Mm-hmm.
with a sense of inadequacy and a lack of feeling empowered. I would add that really stupid people cannot be anxious. You have to have a lot of creativity. You have to be able to scare yourself.
Yeah.
You
Yeah.
have to be,
Complacent people are not anxious about the future.
yeah, you have to really um, be good at that embodied mind stuff. The
Mm.
opposite of anxiety is not looking towards the future and feeling calm and blasé. The opposite of anxiety is looking toward the future with excitement and expectation, especially uncertainty.
Mm-hmm.
Anxiety is, oh no. The opposite is, oh boy, I got this. I wonder how. So, as a matter of fact, if we were measuring sympathetic nervous system arousal, they'd go up for both sides.
Interesting.
But one, and Ross Picard at the affective computing lab at MIT shows that actually it's not exactly the same. Skin conductance in right-handed people tends to go up on the left side with dread and anxiety, and on the right side with excitement and
Interesting.
expectation. So, not surprising, we might be wired somewhat differently. So, the anxiety, the opposite of anxiety and the skill to work towards is feeling a sense of self-efficacy and competency,
Yep.
recognizing I have resources, that I've done this before, and you could imagine the hypnotic work in that. So what have you done before? Let's access those internal experiential resources for competency. And one of the things that I help most is to understand that feeling of struggle, that feeling of being stuck, that feeling of uncertainty
Mm-hmm.
is exactly what it feels like when you're growing
Mm-hmm.
and when you're changing. You're doing it, but it feels hard, right?
Right.
Well, imagine how the swearing and discomfort that going on inside of that chrysalis.
So I want to make best use of the limited time that we have. This is fabulous. I want your comment on the be here now, like be in your body.
Ah, yes, and being present. I have at my office at Easter Seals, where I haven't been for a long time because I've been doing healthcare this way. I took down all my diplomas and all my little awards and things, and I just have in landscape in large print things people have said that are really cool.
Mm-hmm.
Some of them even I've said. And one of them says, I'm always in the moment, just not this one.
Yeah.
So I'm not sure about your question. Are you asking me about meditation and being present versus the realm of hypnotic mind body stuff? Or
Well, for me, if to bring in my clinical work,
Yeah.
people who have been involved with a mind control cult, my frame is that they like have a split or a dissociative experience where they have their cult identity with all the beliefs and loaded language and behaviors and everything else, and then they have themselves, whether or not they
Yes.
were recruited in like I was at 19. I kind of had a pretty formed
Yes.
beginning self as opposed to people born into cults. But what I've kind of said therapeutically, and maybe I need to shift this, is that part of recovering from that trauma and abuse is being present,
Yes.
not getting sucked back into what had been said to you 20 years ago, a phobia that had been put in your head,
Right.
like having the adult
Yes.
resources of the here and now. I
Yes.
totally talk about a positive orientation to the
Yeah.
future, of course, but I just wondered,
Yes.
what
Okay.
you think about that.
You're going to be shocked to hear that I have a lot to say about that. Uh,
Not.
I'll start by saying this: the past and the future are things we make up.
Mm-hmm.
Not only do we make them up every moment of the present, which is all we get.
Mm-hmm.
The Imagine that you had uh, oh, let's be old school, that you have a record player and uh, a record, uh, and that every time you play the record, you change it,
Mm-hmm.
you change the recording. Uh, uh, it would be terrible. I mean, the other day I pulled out Abbey Road. I just wanted to listen to that whole thing again. Why? Because I've changed and it hasn't. And
Mm-hmm.
I hear and appreciate it differently. I've been thinking a lot more about George Harrison and who he was, and that had more of his recordings than anything else. A different present.
Mm-hmm.
I think the but we're talking about time, and there's more than the dimension of time. So I think of it not as being as only being present, but being appreciative and aware of the unknowable depth. So if I'm going to sit and have a meditative moment, and by meditation, I don't mean mindfulness, and I don't mean Buddhist, and I don't mean contemplative because that's more cognitive. I mean a moment where I stop playing in traffic. I personally reflect on the fact that I'm changing gene expression as I do this and
Mm-hmm.
how cool that is. And then my brain starts imagining genes and imagining uh, them unzip and the nuclei, and I say, stop it. You're getting into imagery. That's very cool. Isn't it nice that you do that? Now come back and be just in it, not at it.
Mm-hmm.
And uh, and then all sorts of buts and shoulds start coming in.
Mm-hmm.
Is this the best use of your time? And what about that trauma? And what about that? And what about? And I remember that those are made up. So I think what you're talking about is not necessarily only being present, but being integrative and of it, and in a sense being in awe of the fact that we will never understand ourselves as completely,
Right. No,
and
I
therefore
get
are
that.
very much appreciative of, oh my God. So there's a quote um, from Marianne Williamson, actually, though it was attributed to Nelson Mandela for a while, and we used it to as the opening of our textbook. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure.
Hmm.
So I think this is why people attribute an inspiration to something outside.
Mm-hmm.
I couldn't have done this.
Uh-huh.
But I would also beg to differ with the notion of the term self-hypnosis.
Mm-hmm. Go ahead. We got only a few more minutes, but I
Okay,
also want to ask you about the impact of technology and
okay.
screens
We'll
where we're
talk about
not
that in a moment. I'm just going to say
physically.
all hypnosis is influence. So
Mm-hmm.
my self-hypnosis without any therapy or help is pretty bad.
Mm.
You're inadequate, you're not lovable, you'll never finish this, you're grandiose, you shouldn't even try to do this, you can't do it, et cetera, et cetera. The goal is to change it, and I need others to do that.
Mm-hmm.
And so I would argue all hypnosis is hetero hypnosis that we take in and
Okay.
use either to hurt ourselves or for benefit.
Okay.
And learning self-appreciation is something maybe we have in our first 6 months, and then we start getting influenced. So maybe it's returning that. So technology, well, technology is dissociative, unfortunately, for the most part. If we made a parallel between undue influence and beneficial influence, much of this is to dissociate ourselves from the moment.
Mm-hmm.
Even when we have a health app that we attribute to this thing
Mm-hmm.
that's actually helping us. You know, when my Apple Watch, which I prefer not to wear, tells me it's time to breathe, I say later. I don't want you to tell me that right now.
Mm-hmm.
So uh, creating, it's the same therapeutic challenge. Creating, if we're going to focus on health apps, which isn't really what you asked, creating a trusting, person-centered relationship with this, as compared to the dissociative, I should be better than I am,
Mm-hmm.
which is the influence of social media.
Right.
Uh,
Or your
uh,
beliefs are wrong and you need to think the right way.
yeah, yeah, yeah. Uh, this is, just further evidence of the permeability of our notion of self.
Mm-hmm. Mm-hmm. So we need to wrap up, unfortunately, but I want to mention the new book again.
Yeah. Well,
I,
read the subtitle. Well, read the whole
narratives,
title.
narratives and changing minds with clinical hypnosis, narratives and discourse for a new healthcare paradigm.
Yeah, that's the point.
And
That
and the new healthcare paradigm, to summarize my understanding, is no longer reductionistic and pathologically oriented to disease, but looking holistically and systemically at a person's life as well. And the therapeutic relationship of the healer with the person to empower them to maximize their own resources and power so that they can look with curiosity and confidence and approach the future with resilience in the uncertainty of
yes.
the future.
Well, let me say two things about that. One is not no longer categorical and reductionistic, but building on that core to include a much broader frame. So we are talking about that issue you just brought up in wound healing from the sutures that I got because I played on the playground.
Mm-hmm.
And how we respond to a vaccine. When we receive a vaccine in the face of fear, anxiety, and down-regulating our immune system's abilities, it's less effective.
Yeah.
I didn't just make that up. It's in the 2-volume text of psychoneuroimmunology. that we, and again, see, that's thinking
So
outside of
is
the
it so
boundaries
too
of the immune system.
is it too simplistic to say that believing that the vaccine is going to protect you is the default belief that people should approach it with versus this could be harmful or this could be, a waste of time and energy?
It is an unknown ingredient. You know, uh, this is coming to mind, so I'm going to bring it up. I talked about asking young people in my care. I use the term young people to refer to anybody who's younger than me. Uh, the opposite of their problem as a fake intellectual exercise.
Hmm.
I was working with a young woman who had been hospitalized with multiple suicide attempts, was really doing well. I got to work with her as she came back into her life. And I really sincerely said, I've done this a lot with anxiety and headaches and stomach aches and things, but I don't know what's the opposite of depression. And without missing a beat, she said, oh, that's easy. That's getting really good with loss.
Hmm.
Life is full of loss. Life, change and loss go together. Can you absorb that and say, ouch, yeah, I get that now.
Hmm.
Can you do that? So think in terms, the vaccine has an ouch. To understand, a pediatrician my sister told me about in Vermont said, we don't use the word shots. That's a violent term. We use protection injections.
I like that.
So it's not too simple as long as we understand the depth of what that word believe means.
Hmm.
That term believe means changing gene expression.
Hmm.
That means changing the entire system. We can learn that emotions and immunity are two sides of the same thing, and that thing is mind.
So I need to keep you for a couple minutes longer because this is absolutely fascinating.
Good.
So, what is your knowledge or experience with autoimmune
Mm.
kinds of disease?
Not, I don't have much experience, uh, a clinical experience,
Uh-huh.
but
What's your guess? What's your sense?
there is absolutely that. So this gets to the chicken and egg problem because
Hmm.
we know that immune activation, and that's a simplistic notion as we're coming to understanding. The immune system is a system of checks and balances,
Right?
but when when inflammation is rising, when there is a storm of increased defensive activity
Right?
within the system,
Hmm.
there are unsurprisingly mood changes and attitudinal changes and feelings about self that occur.
Hmm.
Uh, the answer to the question, which came first, the chicken or the egg, is yes.
Right.
So the question is, what do you know how to do better? Change your immune response or change your feelings and mood?
Right.
Well, I know it's the second one for me.
Yeah, me too.
How do I know how to do that? Oh my God, he's going to say something trite like breathing. Yes. Not only because of the parasympathetic and vagal effects of slow abdominal breathing, but the fact is, oh, I know how to control that. This is one of the things I get a sense of efficacy and control on.
Yeah,
So,
absolutely.
so the issue is, I am being simplistic. I'm saying, well, they are linked, and emotion and inflammation are parts of the same thing. Not well defined what that thing is,
Hmm.
and that we can change inflammatory response and modulate with emotional modulation.
Hmm.
And you can't do that just with thinking.
Right.
Thinking is the tip of the iceberg. uh, I gave a talk at the last international meeting, and I referred to hypnosis as climate change. that we're changing the internal milieu,
Hmm.
the emotional milieu, to shape other responses.
Hmm.
Only in this case, it's really beneficial climate change, we hope.
Right. No, it's empowerment.
So it is a wonderfully unexplored field. There are lots of people doing interesting research on using clinical hypnosis in rheumatoid arthritis and psoriasis and multiple sclerosis and other. But I think all of these. I think any growth in one area is going to affect the other.
Yep, that's great. Thank you so much for who you are
Oh,
and
thank you.
all your good work. And of course, your humility comes through. And what I love too is how you are anti-certainty, if I can,
Hmm.
it's the
Yeah.
certain people that I worry the most about. Left
Yes.
wing, right wing,
Yeah.
atheists, this or that. The people who
Yeah.
are so like truth with a capital T and they're not open to other data or other points of view.
When I was a medical student, a wise resident said, when you've done a complete history and physical, gotten all the laboratory tests and put together the formulation and think you've got it, that's when you know you're really missing something.
Perfect. Thank you, Dr.
Welcome.
Sugarman.
Very
Much
welcome. Thank you.
success. Any clinician that works with children in particular, this is still the textbook. And I think for people who are interested in learning clinical hypnosis, they should read it anyway. And this is really a wonderful contribution. And let's stay in touch and let's think
Yeah.
about how to scale our knowledge so that we can make the systemic changes that need to be made quickly
Yes.
to deal with this
Absolutely.
pandemic. Because my understanding is a lot of the people get the illest and even die from the coronavirus. They're having an autoimmune reaction
Right.
where the inflammation and is it cytokine storm
Yep. Yep.
happens and it cascades in the wrong direction. Whereas if people can be uh, helped to get to that more balanced, resourceful place, the likelihood is much higher that they won't
Yes.
die.
And
And
we have lots of caring clinicians in their interactions ripe for changing their language and attitude. And they're learning to do that, but there's so much potential.
yeah, that's great. Thank you so much again.
Very welcome.
And
Thank
we'll be
you
in
for the
touch.
opportunity.
Okay, take care.
Okay, bye.
Bye.